Continuing our series on Operation Be Healthy, and the focus is on hypertension, high blood pressure. So you've been tested and they have found out that you're hypertensive. That means that your blood pressure range, systolic BP over diastolic BP, you have 120 millimeters of mercury and above, over 85 millimeters of mercury and above. You are hypertensive. It's been confirmed. So the health worker has prescribed for you the right antihypertensive medication. Do not sit back. Do not sit back. These are drugs that you're supposed to take for the rest of your life, but they come with side effects. So, how do you go about limiting the complications of the side effects? What are the side effects that come with antihypertensive drugs, the synthetic drugs? Some of them, after long-term use, there are effects on the central nervous system, where someone develops confusion, those feelings like you have mental health problems. You get panic attacks, you get insomnia, failure to sleep at night. But in the long term, someone may even develop another chronic illness, which is diabetes, which is also problematic. So how do you go about this? You must strike a balance between pharmacological measures of managing hypertension with the non-pharmacological. And the common health worker will tell you about the drugs to use, especially because they are doing their job, but they're also selling to you medicine. But this is where I come in. I have to emphasize the non-pharmacological measures for you to manage your high blood pressure. So that if you must take the antihypertensive synthetic drugs, you must take the lower dose, which will deliver less risk of side effect complications. So you need to pay attention to your meals. These are the top 4 hacks, non-pharmacological hacks for managing blood pressure. The food we eat, you must pay attention to it. Keep away from saturated fats, animal fats like fatty meat. Keep away from food with a lot of salt. Keep away from refined sugars. Keep away from alcohol. But include more in your meals proteins, especially plant proteins, beans, soya, you know, these local protein foods that we have, fruits, vegetables. But then about feeding, avoid stuffing your body with a lot of food. Do not eat to overfill, especially someone that has hypertension. Because the moment you overfill your body with food, the excess is turned into fat. And that excess fat blocks blood vessels, which worsens the hypertensive crisis. So eat minimal food to give you enough energy to function as a normal human being. Now, what are the most important meals in a day? Breakfast, lunch, dinner is supplementary and it has to be light. Make sure that you have your dinner by 7:30 p.m. You, the person that is having hypertension, or you who has a parent that has hypertension, clarify these issues. Breakfast, lunch, supper is supplementary. It must be a light meal. And you shouldn't take it above 7:30 p.m. Why do we avoid having supper late? Because your body is preparing to rest. The body, you do not have any serious activities. So the food will be converted more into fat if you eat a lot of it and if you eat late. But if you eat by 7:30 p.m., you will have time to walk around and then there will be some energy use up. So make sure that by 7:30 p.m., you've had your light supper and you're good to go. Maintain an active, consistent physical exercise routine. Do your jogging at least thrice a week. Do your jogging. If you go to the gym, do it. If You do swimming, do it. But make sure that you're doing this under the guidance of a professional fitness expert. Because as a person with hypertensive, there are considerations that they have to do, especially if you go to the gym, and also limiting doing very heavy physical exercises, because your heart and the larger cardiovascular system is vulnerable. And then attend to your mental health. On the weekends, do some gardening. It calms your mind. During the working days, after you work at office, keep away from the phones and the computers. Engage with real people, and then have good conversations. Keep away from stressful conversations. Have inspiring, calming conversations with people to manage your mental health. Because mental health, the psychological factor, also affects the blood pressure of the person. The chemicals that are released, the hormones, the stress hormones, the happiness hormones, all come into play in controlling the blood pressure of the person. Basically, and also ensuring that you have enough sleep. Go to bed early and then wake up early. A minimum of 6, 7, 8 hours of sleep is adequate, and then on the weekends, if you're a working person, you can have 6 to 7 hours of sleep, and on the weekends you can have your 8 hours of sleep when you're not going to office. And then the workers that work in office, the sedentary design of the work sitting at the desk and the computer, you have to be careful about it. Have breaks. If you've sat at the computer for 1 hour, get up, stretch around, go to the washrooms, and then come back. You'll be fresh, but it'll also be good for your body, so that you have to work for a longer period of time and be productive to society. So those are the top hacks, non-pharmacological measures I can give, that besides the antihypertensive drugs that are being given by the health worker, you need to pay attention to these aspects, and you'll be good to go. Thanks for now. See you next time.